Healthcare workers on the front line as they battle new threats which had not been recorded in the area for more than 10 years. Its victims are mainly children under the age of 15 years. For the past 2 weeks, Ndiguts and her team have been carrying out an intensive door-to-door education campaign against this disease.
We are in the middle of a measles outbreak here in Mutasa. It was detected on the 10th of April when one of our alert village health workers in the Zindi area notified the community nursing department that he has met a child exhibiting symptoms suggestive of measles. He had noted that the child had rash, red eyes, and so was coughing with a hot body. So the nursing, at that moment, the nursing department notified the district nursing officer, who notified the district medical officer, myself. We activated our rapid response team. We then went to the Zindi area to do a field investigation. They did see a lot of children with these symptoms, and we managed to take some samples which were then sent to the virological lab in Harare. We took 6 samples of those 6 samples, 2 came out with IgM positive, suggesting that we making a diagnosis of measles.
Measles is an acute viral respiratory illness commonly found in children and is spread through sneezing, coughing and touching. If left untreated, it has a very high fatality rate. Researchers have also been deployed to understand the latest outbreak.
We've come to Mutasa district to investigate the measles outbreak. There's not been measles cases for more than 10 years, and all of a sudden cases were recorded, and we need to find out why measles has re-emerged in Mutasa district and to also find out the response. What we found out is most cases that are the deaths that were recorded are not vaccinated, and we have most of the cases being unvaccinated as well, and only the few that have the measles have mild symptoms.
Strong religious beliefs by the majority of people in the region have emerged as the biggest challenge faced by both healthcare workers and researchers.
We've also managed to access communities where we have managed to look to discuss with a few controls, which are people with children who did not get measles, and the cases are quite difficult. The majority of the cases are quite difficult to reach because some are not willing to access health services, so which also translates to them not willing to have conversations. From our investigations, a lot of them did not have an understanding of what measles is, but a few who had received community education, they now understood what measles was and the dangers.
In terms of the vaccination coverage, we have a target of about 77,640, and we have managed to vaccinate 68,000, so our coverage is around 87%. We are targeting 95% in order to have herd immunity in an outbreak. It's unfortunate that we've been slow in terms of the coverage, because ideally, according to the Ministry of Health and Child Care protocol of outbreaks, we are supposed to have detected the outbreak within 48 hours, and within 14 days, that is 2 weeks, it's supposed to have been controlled. So it has taken us longer due to a lot of factors. One of those is the logistical factors. I think you can see that Mutasa is a mountainous area, so some of the areas are hard to reach.
Authorities are hoping to wrap up the vaccination blitz in a week and contain the outbreak before it spreads across the country. Khayelihle, Khumalo, SABC News.